This is Crystal Fenn with MedPage Today here in San Francisco at the InterScience Conference on Antimicrobial Agents and Chemotherapy, where Dr. Kenrad Nelson of Johns Hopkins University explained why hepatitis E virus is finally starting to get some respect as a public health problem.
I presented a review and some data from the recently described human hepatitis virus. It's actually the fifth human hepatitis virus that's been described, and it's hepatitis E. They're named alphabetically from A through E. There are outbreaks almost every year in India, Pakistan, of tens of thousands of cases of hepatitis, with a 10 to 20% more death rate in women who are in the last trimester of their pregnancy. So to me, this is a public health emergency that's not being dealt with. And hopefully with more attention to global health, hopefully the situation may change, and we're hoping that it will.
Hepatitis E, while a particular problem in the developing world, is common in the United States as well.
We were very interested in what the prevalence or the risk was in the United States. As I mentioned, the first case that occurred in the U.S. was in a farmer in Minnesota who had never been out of Minnesota. He developed acute hepatitis, and they found the same virus, HEV genotype 3, from himself and his pig. So he apparently acquired it as a zoonotic infection from his pig. We decided, in following this up, to do a study of the U.S. population. And there is a population, study that you may know of, run by the CDC, called the NHANES, the National Health and Nutrition Evaluation Survey. It's a randomized survey of the U.S. population, about 18,000 people. Well, somewhat more than that, but about 18,000, they had specimens left. So we obtained these specimens from the CDC and tested them for hepatitis E. And we found that 21% of the U.S. population had antibodies to hepatitis E. Now we're beginning to recognize that this is an important virus. And now with the added twist of people who are immunosuppressed going on to chronic disease, all of a sudden, the whole issue has changed. And the title of actually my talk today was the emerging epidemiology among globally and among immunosuppressed patients. And there are, just a couple papers, because nobody's really looked so far. And the problem is, when somebody who's immunosuppressed and is on 10 different drugs, if the liver enzymes go up a little bit, you may not attribute that to an infection. It's probably a reaction to one of the drugs. So it hadn't been studied. There are just a couple papers, and now there's one case also reported from England of an AIDS patient who developed elevated liver enzymes. He was on a lot of antiretroviral drugs, but he developed, and they studied him for hepatitis E. And in fact, he's carried this virus. So, given our current, the population, the various susceptibilities, I think it needs to be evaluated a little bit more. And in light of this, there is a vaccine that's been tested that's been highly effective, and it's just sitting there. And so I think that this is a problem. Somehow somebody's got to deal with it.
So while hepatitis A, B, and C have gotten the most attention over the years, hepatitis E virus is starting to be recognized as a threat as well. In San Francisco, I'm Crystal Fenn, MedPage Today.